So, welcome to this edition of the Surgeon's Record presented by Commons Clinic. This is the second in our series of webinars, and really excited today to have a father and son spine surgeon team, Dr. Sarbpaul Bhalla and his son, Dr. Amandeep Bhalla, who's a Commons Clinic physician. Really thought it'd be interesting to get the different perspectives, generational perspectives on healthcare, where it's been, where it's going. So my father, I have a healthcare background. My dad was an administrator, so a little bit of the cats and dogs part of it. But Amandeep, was there a certain point in time where you were aware of what your father did for a living, where you said, well, that's really interesting to me. I want to follow my father's footsteps. Was it early on in life? Was it later in life? Or where did you sort of start to think, hey, I want to become a spine surgeon like my dad?
Sure. Thanks for having us, Ben. We appreciate it. Um, I think I started growing up, with a lot of different interests, really. But what I did notice was that my dad enjoyed what he did, and he was happy, and it seemed like he was energized by it. So that left an impression on me. I, of course, had no idea anything about medicine or surgery really growing up, not until medical school, which is when I got more exposure to surgery and as well as spine.
Very nice. And Sarpal, what were your thoughts when you found out Amandeep wanted to follow in your footsteps and become a spine surgeon? Were you like, this is great? Were you like, run away as fast as you can? What were your impressions, or when you found out that Amandeep wanted to follow in your footsteps, what were your thoughts?
Thanks very much for having me in the team. Amandeep has always been a very independent kid while he was growing up. And in fact, he has kept us at bay during his schooling. Whenever we have offered him to help in homework and this and that, he will not let us entertain that possibility.
You didn't know this was going to be an ambush, did you, Amandeep? This is yeah, yeah, it's all right.
yes, so going forward, uh, he actually had I think his first choice was a business, and but at the same time, subconsciously or consciously, he just kept on going into medicine as well. Then finally, he did decide, I think, with the consultation amongst his friends and peers that I like business, I like medicine as well. So what should I be doing it? So he stayed indecisive all the way, even after he finished the medical school. Anyway, I think he finally chose to stay in medicine, and I did not get any indication that he wanted to go into orthopedics or he wanted to be a spine surgeon. I had absolutely no idea because he won't share that. And But I think he, as he mentioned before, that he saw me that I like what I did. So subconsciously, I think he said, well, then maybe that's what I want to be. Uh, so, so finally did, you know, go into orthopedics, and then again, the spine surgery, just like me. Uh, and I think I could only share his the happiness and achievement that he's going to be following my footstep. And I only uh, would give him advice that it's a great field to be in, and my advice to you as a parent and a colleague would be you should practice a high standard ethical practice of spine surgery. It's very rewarding. monetary aspect should never be in your thoughts, and just be a very uh, ethical surgeon, good surgeon, and that's you will enjoy the best.
Very good. No, I think that's a great answer. My dad, when I told him I wanted to be a doctor, his advice was don't be a jerk. That was kind of his advice to me. But I think it's interesting to hear that, Amandeep had the business interests and then, sort of tying into being a good ethical surgeon and then ending up, sort of in a situation like Commons Clinic. So Amandeep, do you find that sort of, being in a situation that's unique like Commons Clinic satisfies some of that business interest, but also sort of ties into and what we're trying to do here is, do good, ethical, evidence-based spine surgery. Do you feel like that sort of ties all those things together?
I think I share an interest in economics, health economics, that you probably have too, Ben, as I've read some of your writing. Um, and the way I see it, economics is really just a study of how things work, and the intersection of a lot of different forces in that space. I think in medicine in the United States, we have this ongoing challenge of how do we get access, particularly to highly specialized medicine, things like spine surgery. At the same time, how do we make it a good consumer experience where patients enjoy it? They know they're able to seek out the type of care that they want, and continue to have agency for themselves in their decision making. And then also on the provider side, how do we provide excellent, high quality, measured, evidence based care? And I think one of the things that really I was drawn to with Commons is that there is an emphasis on that first high quality, evidence based, patient centered care, but also um, outcome measurements, as well as a improved consumer experience for patients, um, a appropriate site of service for particular types of cases, which can also help with cost containment and providing more value to the patients in society.
Sure. And so, Sarpal, you told me right before we got on the call that you recently retired. Congratulations. You spent, I think you said 41 years in practice. So I'm sure things are very different now than when you started 41 years ago. Looking back and sort of looking to the present and the future, how do you view the evolution of healthcare? Sort of, have we lost our way? How do we get back to healthcare the way that it should be? Or what's your perspective, after 41 years of practicing of where we were, where we're trying to get to, and the challenges that we're facing right now?
Well, definitely the medicine has changed a lot uh, in terms of uh, the monetary aspect of it, the reimbursement aspect of it, which definitely had a marked, shown a marked change uh, over a period of time. There was a mushrooming of IPAs, this hospital-based uh, practice of medicine. The insurance companies also, have been slashing their reimbursement. Also, there have been a lot of changes. On the positive side, of course, there's a more and more testings have occurred, have come into practice. We have availability of high-tech testing, and so uh, there were some. It's always some good and some bad. The low value care, particularly in terms of uh, treating the back pains and injection treatments, have also become a kind of a standard practice. Uh, which was not which can be harmful to the patient if it's a over-treated, particularly treatment of a back pain type of pathologies. So yeah, there had been tremendous changes. The other change which I found was just to keep up with the reimbursement. You had to negotiate contracts, private contracts with a lot of HMOs, which is of course is a pretty taxing, and you have to work harder to come up with the same kind of receivables. So yeah, these are the most important changes which has occurred.
Sure. And so Amandeep, if you were going to look at, what your ideal situation is, if you had to design your ideal practice and we didn't have some of these barriers that we have now, what would that look like? Would it be having, a partner that can do some of those negotiations for you and kind of free you up to focus more on the care delivery? Is it, having a say in the business part of it, but not necessarily having to having a good, strong business partner? I mean, what would your ideal practice look like, based on where we are now and your dad's experiences in the past?
Sure. I think with more experience that I've gained over the last decade or so, I realize there's a saying that you want to be an inch wide but a mile deep, and that's how I feel about the practice of spine surgery and in both operative, non-operative management of spine patients. Is I want to I want to be deeply focused in that area, and I think my patients win when that happens. I'm also able to practice something that I love, and stay tightly focused in that narrow band, while allowing other experts to do things like the negotiations, I think, and the background management of the practice, I think is beneficial because I can stay in that 1 inch lane and just try to do my best work and best by the patients I treat.
Sure. And so, the two of you operate together for a period of time? Were you ever in the same case together, assisting one another, or did you have completely separate operative practices?
No, we did. We actually operated for about 7 years together. We probably double scrubbed a couple thousand cases.
Oh,
Imagine roughly maybe 1,500 to a couple thousand cases. And it was fun. When I first came out. Obviously there's no substitute for experience. There's so much I learned from watching how my dad, thought about problems. You know, how if there was a complication or challenging situation, how he would navigate it, how he'd think about it. And at the same time, there was like a natural tension because I had just finished my training and I was like, oh, I'm ready to go, And so, but we had a really good, fortunately he's very patient and and so it worked out really well. And we had, I think his patients loved that I would be double scrubbed on the case too, and then my patients really enjoyed knowing that my dad would be double scrubbed on the case. They think they felt like the energy was positive and that it was like a family affair that we're going to do our best to take care of the person on the table.
very cool. And Sarpal, was Amandeep a good, receptive student? Was he hard-headed? Did he take instruction and criticism well, or did he try to do things his own way?
No, it was really a pleasure that to work with him. Particularly, he's fellowship trained about almost 30 years later than I was fellowship trained. So definitely, I enjoyed his, the thinking, how to solve a problem, and uh, he will take the guidance wherever I may pitch in. very well. And I must say that we have never had any argument while we are operating. We are together
Very
on the
good.
table, and the OR crew, I think, respected that. Yeah, then in fact they will say it's an exemplary way of working together. Father and son.
Yeah, for sure. No, it's really cool, and I think I think it was more commonplace in the past for surgeons to double scrub with one another, particularly out of training early on in practice to have an experienced surgeon double scrub with a younger surgeon. I think we've lost that. We come out of training and then you're sort of thrown in there on your own, and I think we probably need more of that. We probably don't do enough of that sort of mentorship when you're out of training. My question is, who got to set the table height? Are you both about the same height, or who was able to set the table to the preferred height?
Of course, I will always have to use two stools, standing stools, to come up at his eye level. You see,
There you go. Yes, very
yeah,
nice. You didn't make him stoop over the table.
yeah.
That was very
Whether I'm a
nice.
surgeon or I'm assistant,
Yeah.
I have to go according to his height.
Yes, very good. And what was the most challenging? You remember the most challenging case that you did together? Was it like a front back spine? Was it a really, complicated deformity? Was it something that seemed straightforward that ended up not being straightforward? Does anything stick out in your mind of a case that was like, really unique that you did together?
And I think maybe I'll have Aman answer that.
Yeah, we really took care of a lot of different types of pathology, and as you know, Ben, I mean, every surgery has their own nuances. So even something as simple as like, or I shouldn't say simple, but as what one would think would be straightforward, like a decompression, lumbar decompression, to doing long deformity constructs. There's always nuances I would pick up and learn. And we would iterate together, try to get better. But yeah, we had plenty of tough cases. I think there's plenty of cases I look back on. I was like, oh, it was really good. It was great that he was there as well, and I think vice versa. So it's fun to have a such a reliable teammate in the OR.
Yeah, very cool. And then did you see patients in clinic together as well? Did you run separate clinics or were you also team in clinic?
Separate clinics. We had to draw the line somewhere, but but yeah, so we would actually send each other second opinions too, of course, just to get
Yeah,
a second set of eyes, and
yeah,
um, but yeah,
yeah, yeah. Very neat perspective.
But
Uh,
we did discuss the patients well in advance. How we're going to approach either his patient or my patient. We will
yeah.
consult each other way well ahead of the time.
Yeah, I think that's another lost art too, sort of having the pre-op conferences and particularly, like me being in private practice, we don't have resident conferences. We don't regularly hold, I do joint replacements. We don't regularly hold joint replacement conferences. Yeah, we'll sort of curbside each other in clinic or what have you. But I think it's really also a lost art of discussing cases and having that academic discussion. How would you approach this? And then even, post-op, hey, this is what our post-op x-rays look like. This is what we did well, maybe something we could have done differently. So yeah, I think that's a lost art as well. That would be great that we could get back to. So, parting thoughts, with Sarbpaul's retirement and Amandeep's partnership with Commons Clinic. Sarpal, what's the future for you? I know Amandeep, you have a recent child, baby, and so I don't know if that's the first grandchild or what's on the docket for each of you, in the future going forward.
that's how
Few-
we negotiated. His retirement. He said he needed something to keep me
Oh,
busy.
that's so now that timing makes sense now. There you go. Yes.
But yeah, and it was such an honor, honestly, to overlap for 7 years. I felt really lucky just experientially. I mean, it was almost surreal. I think my dad and I, we still talk about cases and stuff like that, but our conversation has evolved away from just spine at at the dinner table to other things, the softer things, like family and things like that, which
Right.
has been a good evolution. Yeah. Yeah. What
Cool.
about you, Sir Paul? Any thoughts on your retirement?
Yes, I think I had a very successful, satisfying practice, and uh, thankful. I'm very thankful to that. And uh, we still discuss cases whenever there's a need to be, but we are going, as he mentioned, more and more. I am going into cooking and some piano playing, uh, getting more and more into physical exercises. So these are the things which are keeping me busy. Of course, always looking forward to play with the new addition from Amandeep in the grand family.
Yes,
So
maybe another future spine surgeon.
there
You
you
never
go.
know.
There you go. Yeah, no, I'm enjoying. I'm enjoying.
Excellent. Yeah, very good. Well, I think that's a great place to wrap up the conversation. Really neat to hear the experience of father and son, spine surgeon team, thoughts about the past, present, and future of medicine and musculoskeletal care and spine care. So, thank you both, Amandeep and Sarpal, for agreeing to be on the surgeon's record. And we look forward to following Sarpal into retirement and seeing what Amandeep does in his career with Commons.
Uh,
Thank you,
Thank you.
Ben.
Thank you for it.
Thanks.